I'd like to introduce Bharat Shyam. He's IIT Bombay alum, founder and board member of Restart Partners. He's also the founder of Silk Cloud, serial investor with early investment in about 20 startups with majority of successful exits. He has served at Washington State Cabinet as the first CIO of Washington State. In addition to all this work he has been doing, he's also an active volunteer and works with several nonprofits. And I'd like to add this note that he's very much driven by empathy and has a lot of respect for people who serve the community. Welcome, Bharat.
Unmute yourself, Bharat. Bharat, you need to unmute yourself.
Yep, I guess you can hear me now.
Yes.
Yep.
And can you also see the screen? I think you can, yeah?
Yeah.
Yep.
So it's humbling to come after so many speakers, and I really enjoyed all these talks, and I'll try to give you a different slice of my experience here. And, you know, I was invited here because I helped found Restart Partners, which is a nonprofit focused on saving lives and livelihoods. Our focus is primarily in the US, and I'll give you a little bit of our journey. First, I'll tell you a little bit about myself. You know, I went to IIT Bombay, did computer science, moved to Stanford to do a PhD in computer science, but ended up joining Microsoft for a variety of reasons. And that plays a big role in terms of, you know, my father was killed by terrorists a long time ago, and that's why I had to go join Microsoft. And but also drew me to COVID down the road because you know, unnatural loss of life is something that I have experienced and have a lot of empathy for. I spent some time in the Washington State Cabinet working, after working for about a couple of decades at Microsoft. I worked as the Chief Information Officer for Washington State and founded a venture-funded company that was sold to Unity that went public a couple of weeks ago. It was a great exit for a lot of the employees of our company did really well, investors did really well. And then you can see a grab bag of logos where I've invested. It's all my own money. I really enjoy analyzing markets or analyzing whether founders will be successful. And a few of these have actually been very active in healthcare delivery. Zipline is a company, flyzipline.com, which is the only company that's been doing any delivery with drones. And they just did a deal with Walmart, and they've been instrumental in improving access to tests substantially in Ghana, as an example. And there are other companies like, you know, Sentinel Healthcare, which works on remote monitoring from before. But you know, all that comes to Restart. You know, I had a family member who was immune compromised. My wife was fighting cancer when COVID kind of broke in Wuhan. And so that got me a little worried, and I was actually tracking. I have, you know, I'd done business in China from the company Silk Cloud that I'd founded, and my co-founder is actually living in China right now, working for Unity, and so I could see it kind of crashing on, and he said something to me in, I'd say, late January. He said, "China is going to defeat this. I don't know about the rest of the world," and he was, you know, it was spot on. So in late February, I was actually pushing very hard at governments in Washington State, telling them that we have to get ready for a lockdown. And it was, you know, I wrote an op-ed and sent it out. They wouldn't print it. And I have a, you know, substantial number of government contacts, and generally no one was ready to listen at that time by end of February. So I actually moved my family. I did some research and found a couple of cities that had the best ICU to people sort of ratio, and moved to Bend, Oregon for a little bit. And I was living in Bend, Oregon in March when a friend of mine and I started talking about a friend of mine who's a venture capitalist, who started talking about PPE and, you know, acquiring PPE for poor people. And we decided at that stage the Washington State had shut down, lockdown. Oregon had locked down. We contacted Washington State, and there was a very different attitude, and they basically were looking for help. And we said, like, you know, how can we help? You know, and what transpired is the creation of this nonprofit, which actually got a $1 million grant from the federal government, and so on. So let me just sort of start from that. So, one of the things that we would start focusing on is like, hey, we need to open up the economy, but also keep people safe. And we quickly realized, and I just finished reading a book on the 1918 pandemic, fantastic book that if you want to, ping me. There are a bunch of very interesting books that are now back in circulation. But I just finished reading one, and Bill Gates basically echoed a similar point that book had made, which is there is really no middle ground. And it's really tough to say to people, keep going to restaurants, ignore the pile of bodies in the corner, go to the mall, because there's a politician who thinks that GDP growth is all that counts. And you can get this recording in a TED interview. So really, the only way to open up the economy is to keep people safe. People will transact if they feel safe. They won't if they don't. And in this context, one problem that government leaders had was, how much PPE should we buy? Should we buy 1 million masks, 100 million masks? And we've worked with several very large governments that are bigger than most countries in the United States. And there's an extraordinary amount of PPE that was purchased, but people wanted to know how much they should buy. And so that was one of the first problems we set out to solve. We created essentially a model, and it has 4 things that kind of played into the model. Population data with an ensemble of statistics related to the Bureau of Labor Statistics, and typically the states also will do this work, sometimes cities will do this work. So you can actually tell the number of physicians in Palo Alto, plus or minus a small percentage, or the number of physicians in America, et cetera, et cetera. And then burn rates, we worked with a whole bunch of people, including Johns Hopkins, MITRE, Washington Department of Health, WHO, CDC. Turned out along the way, our genius leader basically stopped contributing to WHO. And so the Gates Foundation ended up being the biggest contributor to WHO. And we have leaders from Gates Foundation who are working with us. And so we got access to a lot of good work done by WHO and the CDC leaders. And then infection rates or spikes or predictions of that are an input. It's somewhat slightly harder to use that input because, if there's a real horrible spike, people stop going to the hospital for a bunch of minor issues. So in some ways there's a saving and there's an extra use. And anybody who walks in with a broken leg should be assumed that person has COVID, as an example. And then, you should be able to adjust what stockpile is needed. So we built and we worked with 20 plus governments. Some of these will be giveaway here, Washington, Utah, or some of the ones. We've also worked with other governments. And we created these models that look like this. You don't need to look at this, but, for instance, this is the healthcare provider prediction, if you will, for Washington State. And it says, this is the number of masks. This number here is 13.6 million for a 60-day stockpile for essential healthcare workers. That's a lot. That's a lot of money too. So, and off it goes. And when you get around to gloves, this projection here is 110 million gloves. If you've ever been to the hospital, you'll see that they use a lot of gloves for 60 days for essential workers, another 63 million for non-essential workers. And there are burn rates, and I could go into this model. Each of these tabs has different data and different explanations. And this was really a godsend for people for whom it was not in their remit. No one ever thought that they're going to be buying a whole bunch of PPE. So, and as we started doing this, we realized, we started looked around at society and said, like, what is going on in society? Just because we pile up a stockpile of masks for an emergency in a community doesn't mean that, they may not be used. There were people who considered it tyrannical to adopt this very simple thing like a face mask. There were people who felt that they were invincible. Interestingly, young people are seeing some longer term effects, and maybe even, very long term effects. We don't know. There's this really interesting sets of papers about, in a Petri dish, at least, the virus kind of slices up heart tissue. It causes other kinds of attacks on different organ systems if you're unlucky. So, what can we do to address this was the question that we asked. And one of the things we said is like, hey, let's try to, figure out if we can just have these simple science-based messages that we can get out to people. here's this photograph up above here to the top left, which is Korean kids in 2015. And this is a bar, I think, in one of the Dakotas or Montana in 2020. So this is, America was not one of the brightest societies in terms of adopting simple things like this. And in some ways, came right up my alley because, for the most part, one of the biggest areas that I worked in, both politically and as a nonprofit, is gun violence prevention. It's kind of similar, you can do basic things with guns that prevent deaths from happening. And here are basic things with masks. And so, we focused on, I'll show you the next slide, a bunch of messages we created. We worked with, say, Facebook. Facebook has donated a bunch of ad inventory to us, design resources as an example. And I'll show you some of the messages that we created to help, lots and lots of messages that we have tested. And then looking ahead, if you had asked me a month or so ago, I would have wondered, like, maybe we have dodged this fall surge, but it's looking like we're going to have a really bad fall surge. There are a lot of models like the IHME that say that it's going to be worse in the next 3 months than in the worst parts of earlier this year. And so maybe there's still opportunities for us to keep testing these messages, such as, like, don't have the Thanksgiving dinner. Do not travel to see your family, do it over Zoom. There's a whole bunch of things that we can do. Indoor gatherings are really, really bad. And it doesn't help that, the White House has something going like that, even as we speak. These are the kinds of messages that we had. We had a wear a mask campaign very early on as we emerged out of, in June, July in Washington State. Very early on for the United States. If you look at Taiwan, the Prime Minister, she basically had the entire needs for Taiwan acquired on January 20th. In Korea, it was in February. But nevertheless, for America, this was early on, and this is the governor and his wife. Lots of different messages that we tested. Some of these messages here that you see here actually tested well. There are other messages that didn't test well. It's fascinating. We ran tests in, say, Oregon, and the people get so upset about simple messages like wearing a mask when you're on a bus. And of course, the federal politics haven't helped. If you've noticed, as late as last month, wearing masks in public transit was a message that the CDC wanted to put out, and the White House nuked it. So and then as we did this, we realized more and more that we need to go and acquire masks for poor people. Here are some statistics. I picked California because of, Bay Area. 31% of California is Hispanic. 61% of the positive cases and 50% of the deaths are Hispanic. 2 million children in California live in poverty. 7.5 million Californians live in poverty. I mean, these are statistics that anybody who's looked into social welfare in the U.S. knows. The bottom 30% of the population in every state is in pretty tough shape, unlike you folks who are all probably in the top 10 or top 1%. And so, to the extent that you can help the poorer people in the U.S., their situation is typically not as dire as in India. And I was so impressed by what Balaji Sampath has been doing, but we have some of our own problems here as well. So we've got one campaign, for instance, to get millions of children's masks and distribute them, and that's going well. So that's another thing. So there are many ways you can help. The best way you can help is adopt safe practices, spread safe messages. Keep distance. Especially in California, you can always meet outside. Walk outside. Donate masks and money, and use models if you're still trying to estimate PPE needs. There are systematic ways in which you can do it. So I'm going to just switch gears a little bit and sort of talk about, as an investor, what are the trends that I'm looking at? And I'll touch upon a few of these. A lot of these have already been touched upon by others. Education, we have talked about a lot, and that has been accelerated. Work, Microsoft just announced that anybody can work from home for a good chunk of time. Remote monitoring and other, like healthcare has got a huge set of changes. I won't be surprised if this pushes us into Medicare for all finally. So healthcare becomes a right in the US potentially. India has got a huge problem because the poorest people get some healthcare from government and the richest people don't have to worry about it. But there's hundreds of millions of people, probably 500-600 million people in India who have no health insurance. Even if they're employed, the max that's paid out is 6 or 7 lakh rupees, and that's it. Retail is flat on its back, but it'll change heavily. Logistics is interesting. I think that there's going to be, let's talk about manufacturing and logistics. A lot of manufacturing is going to come back onshore as and when it can, and how that happens is going to be very interesting, because it's very hard to have concentration of parts in one part of the country like we do in China, like in Shenzhen. Everything can be manufactured there, or there are these clusters. So initially, at least as manufacturing comes in, logistics, quick delivery is going to be really important. Travel and tourism, man, this is really in trouble. This is really, really in trouble. Diversity is something that the country has always struggled with. Both India and the United States, we are both, diverse democracies that are examples for the world. But it has come back front and center here in terms of how important it is. And this is, as important as the 1960s civil rights. Every business, everybody has to think about this when they run business. And climate change, no one's going to scoff at it. Once Biden wins, it's going to be absolutely a huge thing. Nobody is going to say like, oh, this can't happen. We got a trial run. We're seeing this with wildfires. So climate change is going to be a big focus for changing the world in a positive way. And with investing, we're seeing this world in which the philosophy of having the Fed and the government come in a big way and spend money in a huge way when there are problems seems to work in advanced economies. And because of global supply chains, inflation is kept in check. So, what does that mean? What does that mean as an investor as you deploy capital? There's a lot of very interesting discussions there, and no time to go into all of that. But there are also risks. One big risk is us blaming China for this. I don't know how many people know that the Spanish flu started in Kansas, and not in Spain and not in China. This can happen anywhere. This has nothing to do with China. China actually was, if you look at the papers published in early February or late January, China was putting out all the information that was necessary out there, and we're still struggling to digest it as a scientific community and as a public health system. But there's a huge US-China, and this is basically a struggle of superpowers. And in the midst of this, there could be closing of borders. Immigration may be hurt heavily. If you have parents, get them green cards now, because we don't know how things will go, especially if Trump wins again. And with trade as well, trade barriers may not go away, although with the Democratic win, there's a possibility that trade barriers will go away a little bit. And all of us are focused on how the internet has been hijacked in a world where everybody was focused on the internet as a source of connecting to the world. And I think, this is a sort of a great reckoning for the internet, where we know the tool can be used in a really bad way. And restoring trust in government is so important, and trust in community, because, coming from India, we know how badly things can get if you don't have trust. And right now, trust in government and trust in communities are at an all-time low. So every one of you can go out there and do a little bit to build trust, to do good works in the community, to do things in the community that help people. And, inequality, I just leave it there front and center, because a lot of you have made money in this, as have I. Have made money in this, investments have done well, but a lot of people don't see anything at all. And these are the people who helped propel Trump to power, and helped propel this sense of xenophobia and hate, because they were worried about how their lives were turned upside down. And now they're coming back into the fold in droves, like seniors are going to vote for Biden. But we have to step up in this country and do something for inequality, because a lot of us are well-to-do and have incredible opportunities. So how does that person who lost their job in working for a restaurant, or who lost their manufacturing job, how do we help them, is something we should all think about. With that, I want to say thanks for giving me the opportunity. And I don't know if there's any time for questions, but please feel free to contact me. It's bharatsS@gmail.com.
Thank you so much, Bharat. Yeah, there are definitely a lot of questions from our side. Before I dive into question, very sorry to hear about your loss, and huge respect to you for taking that pain and loss forward in terms of action. So thank you so much for doing what you're doing.
Yeah, a long time ago. So yeah, I was a kid then, and it's just part of my life. Thanks, though.
Sure. So now diving into questions, let me address Amit's question, who is our president. Amit's question is, when do you expect we'll get back to normal?
Yeah, this is something that, it's just one guy's opinion. I think we're going to see by January, a lot of things in phase 3, the trials are going well. I attend a lot of talks by people like Archana who are, doctors and experts. So by January or even earlier, maybe as early as November and December, we'll start seeing FDA approvals. The big problem in the US, unlike what Mukesh said in India, there's a lot of trust. If you look at the studies, there's a lot of trust in India for vaccinations. Whereas here, if you look at it, the latest study that I saw, latest poll that I saw, that only about 1/3 of the people are willing to get vaccinated. And so there's a lot of distrust. And this is where I think that we might be, as our nonprofit Restart partner, we might start focusing on messages, working with Department of Health in Washington State to try and show people why it makes sense. But there are other very interesting dynamics here. Already in India, there's a fantastic report that came out from India. And of course, in the US, nobody has read it yet, where they took 4 healthcare workers who had COVID and they got COVID again 3 months later. And they said, let's just get to the bottom of this. They genetically sequenced the COVID virus from the first attack and the second attack. And when sequencing, they said yeah, it's a heavily mutated different version of COVID. So already getting COVID once, which should be a really good vaccine, doesn't give you immunity enough to get away from the second version of it, which is not a surprise, by the way, because coronavirus is the cold virus, right? I mean, we all get colds, and the reason we haven't had a cold vaccine is because it mutates fast. So there is that worry. People may not basically take the vaccine because they mistrust it. And then secondly, there might be every 6 months to a year, you may need, and then the third thing is that there's a massive cold chain. Some of the vaccines need minus 90 degrees Fahrenheit, crazy stuff like that. And the fourth thing is some of the vaccines need 2 doses, 2.5 doses. So I think there will be a period of confusion. If we have the leadership we have today federally, God save us. God save us. But if you have a better leadership, perhaps we can all get together and have a more logical conversation. In terms of manufacturing, it turned out that in September, I was actually in India on a business visit and met the guy, Adar Poonawalla, who's now in the news heavily, and visited Serum Institute of India for, this company Zipline. And, he has stepped up in a huge way, and there are people like him who are producing massive amounts of vaccines that are going to be available. So initial supply for people affected will be available, but after that, will people adopt it? So if you look at what Gates is saying and Fauci is saying, they say by September, things will be good. My daughter took a gap year and moved to Korea, and she's going to attend Stanford. And so hopefully by September, she'll be in the Bay Area attending Stanford, and that's what she's betting on. And I'm hoping that by September, I'll be able to visit India again. So that's my hope.
Absolutely. So a lot has to come together.
Yeah, a lot. There's a shortage of needles. There's a shortage of containers, glass containers for vaccines. And this is just in the US, let alone worldwide. So the PPE issue is going to be repeated in a much bigger way, because if you can imagine, there's all this stuff has to be much more sensitively manufactured and distributed and administered. So it's going to be a huge challenge. And I think there'll be opportunities for all of us to help.
Absolutely. I'll take a question from Q&A from Dhawal. In what areas, if any, has USA regressed beyond point of no return, irreversible? You probably addressed it to some extent. Do you want to add more points on that? It asked the question in the direction of moral.
Yeah, I think hopefully progressed in some ways as well. But if you say regressed in terms of risk, my worry is that the struggle for economic and political and military dominance with China has kicked off a new Cold War. Even though if you look at it culturally, except for the fact it's not a democracy, should be a friend. There is no religious fanaticism, a lot of focus on capitalism, a lot of focus on progress. My hope is that we'll be able to, as cultures, come together and work together rather than fight each other for dominance. I mean, that's my biggest worry. And this xenophobia against China is really widespread from what I can gather in India as well, because of some of the border clashes that have happened. it opens up opportunities for investment in India. Money ought to be rushing into India because now suddenly China becomes a difficult place for American or European money to go to. So that is the one where I feel like it's, Ray Dalio has got some interesting postings. Like he's got 6 or 7 parts. So go look over Ray Dalio, who runs the world's largest hedge fund, and he's got some really interesting analysis of the clash between superpowers, which happens all the time, by the way. Every time an empire struggles, another empire comes to the top. And this may be the century for China, or the next couple of decades, maybe China will dominate. So that I think has changed beyond. Doesn't matter. The policies to China will not change dramatically, even if Biden takes over. So and yet all our PPE is still coming from there. So there's an interesting sort of dynamic there.
Amazing. So we talked about the angle of policy and politics, and in general direction of community and working together on that. I'll switch a little bit on the technical side. So you mentioned that you're using data models and trying to derive decisions from that. And I've looked at your website and looking at your presentation. It's a lot about COVID right now, which is definitely the need of the time right now. How do you see that scaling to other areas of opportunities and challenges that you mentioned? Do you have initiatives going on for other verticals or other opportunities that you mentioned using that same data model or technology to grow further than that?
Yeah, our nonprofit, when we created it, we're now a 501c3. We the IRS sort of gave us that. Our hope was that a year since formation, by March of next year, now we're extending our time frame more to maybe April, May, June. We want to shut down the nonprofit. It was like focused. Like we have a lot of very prominent people on the board and on the volunteers, like a dean from the University of Washington School of Governance, as an example, or the person who ran philanthropy for Microsoft. But our goal is to shut it down. Now, for all of us, we have to live in the world past that. And so certainly I'm trying, as an angel investor, investing my own money, to think actively about what the opportunities are coming out of this. But that nonprofit, our goal is COVID restart, and then we're done. We'll shut it down.
Awesome.
At this moment, no desire to keep it open beyond maybe June of 2021.
Awesome. Thank you so much, Bharat. This was a lot of good information. Thanks.